Thank you. My name is Milton Wolf, and I'm the leader of the conservative wing of the First Family. And it's true, I am the doctor who is Barack Obama's cousin, who had to take a stand against his health care plan. I've never been involved in politics before. I've never been part of a campaign. But when I studied his disastrous health care takeover, I knew I had to take a stand for my patients, for my profession, for my country. I knew I had to be here today to take a stand with you. So I did the only thing I knew to do. I started a humble little blog website, and you can check it out. It's at miltonwolf.com. I thought that was healthier than just screaming at my television. And it started getting noticed, and people started calling. My phone would ring. I'd get emails. I started getting invited to speak here and write for this newspaper and do some radio, do some television. And that was all pretty cool. I started having things published out in some of the papers around the country, and I'd get phone calls from family and friends across the country I hadn't heard from in years, and that was very cool, mostly. And then I started doing the morning news programs and the Fox and Friends and did the Sean Hannity TV show. And yeah, we love Sean, don't we? He's a great American. And then things started really snowballing at that point. I started getting thousands of emails in. I think right now today I checked and I'm trying to get caught up. I think I had 1,642 unread emails, and I'm working on them. And people started taking notice, and all sorts of things started being said about me, things I never would have imagined, good and bad. One night is just a great piece of entertainment. My wife and I went through, we started looking at what they were saying about me on the Democratic Underground and the Huffington Post and Media Matters. And I'll tell you, if you ruffle their feathers, you know you're doing something right. And just about everything has been said about me. They tried to say, you know, he must be a racist because he's coming out against the president. And I thought, you know, you need to know our family. I mean, we're a very diverse family. Of course, everyone knows our most prominent member, but we actually have just about every ethnicity represented in our family, from East Indian to Korean to China to Native American, European. And, you know, we have a family that looks like a Benetton ad. And maybe not dressed quite as well. I'd like to say that our family looks a lot like the good world that God made. And so that didn't really stick around so well. So the next thing I said, well, you know, I wonder if he's a real doctor. I wonder if he's even a real doctor. And I said, you know, I'd be happy to show you my diplomas. I'd be happy to show you my degrees, my college transcripts. I'd even be happy to show you my birth certificate. And so, you know, at that point, that's when the sharp knives really start coming out, and they've said all sorts of things about me. They said about me that I should be the next president of the United States, and they've said of me that I probably have a mental disorder. And both of those came from within my own family. No, I'm not kidding about that. Geraldo Rivera, we all know and love Geraldo, right? He went on air and said of me that I'm a prop, that in this whole healthcare debate that Dr. Wolf is being used as a prop. He's just a prop. And I thought, you know, my medical career is starting to be measured in decades now, not just years. And so I challenged him. I challenged him on air. I'll continue the challenge today. Geraldo, I will debate with you, or I'll have a cordial discussion with you regarding America's healthcare anywhere you'd like. I'll go on your show. You can have total control of everything. You can control the microphone, the sound, the lights. You have control of everything. I'll just keep control of the facts. But I will debate you anywhere because, frankly, Geraldo, I've heard some of the crazy things you've said about healthcare, worried about these children who get their immunizations from emergency departments, and just some of these just odd things. And I thought, you know, Geraldo, your understanding of the American medical system is about as empty as Al Capone's vault. Well, it's been many years since I've taken the oath to my patients, and in those years I've come to know the joys and the burdens of that oath all too well. I have stood with families in the best moments of their lives and in the worst. I know the profound honor of delivering new lives into this world, and I have been humbled trying to stare into that unflinching face of death. And it's in those moments that I ask myself, what if? What if I had known this, or what if I had done that? Could I have made a difference? And I suspect many of you here today have asked yourself that same question, what if? What if you had gotten off the sideline? What if you had gotten involved? Could you have made a difference? Because freedom isn't free. And like was said earlier today, like Ronald Reagan said, that liberty is never more than a generation away from extinction. And I understand that better today than I ever did when I see what our government is doing. And we are witnessing right now the collapse of an American presidency. And I take no pride in saying that. No good American, no patriotic American should be happy to see a presidency collapse under its own weight. But it's doing so because of the unbridled hubris of this administration. And primarily it's doing so because they decided to force the government takeover of health care expressly against the will of the American people. And they did so by making so many unkeepable promises. And in fact, if you look at yesterday's Washington Times, you'll see a piece they actually put on the front page. And believe me, I've heard from family all over the country because of that one. But they put a piece of mine on the front page, and it talks about the Obamacare unkeepable promises. And Barack Obama made so many promises when he went out selling his health care. And I've gone around the country, and I've tried to say what my understandings of health care, and sometimes I feel like I have to go and apologize. Last week or the week before, I think it was, I'll tell you what, I've traveled in so many places, met so many wonderful people, and shared the stage with so many great folks, people that I've watched on television and just admire, and the next thing you know, I'm getting to kind of hang out with them. And I'm in Pennsylvania, I think it was a couple weeks ago, and I felt the need to apologize, and I wanted them to know that not everybody in our family thinks that they are bitter clingers. And I told them something. I'll share with you what I told them, because I don't think they're bitter clingers at all. And if they are, then I guess I'm one. Because I love the Lord our God. My firearm of choice is a Glock 23, and I have antipathy towards no man, only towards bad government that destroys our freedoms and mortgages our children's futures. Thank you. So I look at these promises, these things that have been said, and the promises that this president has made about Obamacare. And the first one was that if we would just allow him to take over our health care, if we would just give up that liberty, then he would reduce our deficit. And now, you know, even his own actuary has been forced to admit that his plan is going to raise the deficit, not lower it. And you don't need an economics degree to say you're going to add 30 million new customers. You're not going to do anything to hurt your existing customers, and yet the cost is going to go down. I mean, that's just wishful thinking. We might as well make a law that says it's never going to rain on weekends. He says that you can keep your doctor, you can keep your insurance. If you'll just allow us to take over your health care, you can keep your doctor. But the New England Journal of Medicine showed a survey that almost half of the doctors are seriously having to think of leaving their practice if this is fully implemented. You can't keep your doctor if your doctor can't keep his practice. He promises you could keep your insurance if you'll just allow this takeover to happen. But you know, we're seeing already companies are getting out of the insurance business altogether. In my home city, in Kansas City, we have companies that are already getting rid of their child-only policies. We know that people are right now being turned away at college campuses. Universities are no longer providing insurance to their students. And companies right now are facing a very difficult problem. If you want to keep your insurance through your company, they're either going to have to lower your salary to cover the increased cost, or they're going to have to give you less insurance. Either way, you're not going to be able to keep that insurance. And Dr. Tom Coburn, senator from Oklahoma, says 90 million Americans are going to lose their insurance over this. They're going to be forced into the roles of Medicaid and to government exchanges. And he's made other promises too. He said, I'm going to take care of the senior citizens. If you just allow me to take over your health care, I'll take care of the senior citizens. We are watching the wholesale collapse of Medicare Advantage as we speak. We're seeing hundreds of thousands of people who are facing the problem of not being able to get their Medicare Advantage because this president chose to cut $500 billion out of Medicare and move it into other parts of his health care plan takeover. A significant number of doctors won't take Medicare right now. Many of you are probably aware of that because they can't stay in business if they try to go into business with the government. And so, you know, you can wave around your shiny Medicare card all you want, but if you can't get a doctor to take it, it won't do you any good. He's made promises that he will not have increased taxes on any family earning under $250,000. And he has said that so clearly. And yet he puts all of these new excise taxes within Obamacare. And if you ever need an MRI, if you need a tongue depressor, if you need somebody to take your blood pressure and use a blood pressure cuff, all of those will have increased taxes on them. They will all be passed on to you. But it doesn't end there. Within Obamacare, there are new taxes on everything from tanning salons to tampons, from gold to the sale of your home. And so when he says there are no new taxes, it's flat out wrong. Now, House Speaker Nancy Pelosi, we all know and love her. Not to be outdone, Speaker Pelosi added a promise of her own. She said, if you allow us to take over your health care, then Obamacare will create 4 million new jobs, 400,000 almost immediately. Nancy, we're still waiting. And there's one other promise that the president made. In fact, it was actually candidate Obama made. 8 different times he promised that he would hold health care hearings in public. He would invite in the C-SPAN cameras because he said that way Americans could know who was really on their side. And not one time did he do that. And so I've actually invited him or challenged him just this week to say, you know what, let's invite those cameras in once and for all. And you and I will have the most polite and cordial conversation about health care that any two people can, because I don't hold any of this against him personally. I've said everywhere I've gone, I'm against the plan, not the man. I'm proud to say I'm his cousin. But there are a lot of things wrong with Obamacare, and Americans deserve to have that discussion once and for all. But the most heinous of the promises is he promised that there would be no health care rationing, that the government would not deny people of health care. He said it over and over and over again. But then, under the cloak of a recess appointment, he appointed the man who would do it for him. Donald Berwick, the new head of Medicare, has said openly and with glee that he's going to ration our health care. He just promises that he's so much smarter than us that he can do a better job than we can. He says that he looks at the British system and he says that, in his word, he says he's romantic about it. Let me tell you a little something. I'm a radiologist. I do a lot of cancer imaging. And so I looked at the cancer statistics and the cancer performance of the American medical system compared to the British. The British have a higher mortality rate in colon cancer by 40%, breast cancer by 88%, prostate cancer a staggering 604%. I don't see anything there to be romantic about, Dr. Berwick. That translates to 125,000 unnecessary American deaths if we accepted those. And that's just in those cancers alone. That doesn't include heart disease and stroke and all the other major killers that we're better at than they are. I see nothing to be romantic about. And the idea that you would ration our care is unacceptable to us, especially after you created for yourself a golden healthcare parachute where he has his own private insurance. Even though he's now a government employee, he will never have to live under the Medicare rules that he installs. So I've gone around the country, I've talked about all this, and I say the bottom line is we have to repeal this thing. And people will tell me, you can't do it. This is too big. You can't repeal this thing. And I have one message for them. Let me be clear. Yes, we can. Can we elect congressmen in November of this month? Can we elect congressmen who will repeal Obamacare? Yes, we can. Can we elect congressmen who will hold dear to our Constitution and our founding principles of limited government? Yes, we can. Can we elect congressmen who believe in the free market and that it is the most powerful engine of human prosperity the world has ever known? Yes, we can. And so, I've gone around. I've not been secret at all about my opinions. And I was driving in, of all places, central Kansas. I am from Kansas, and I have to say, I hope you'll forgive me for this, but I have to say, I'm proud to be a Kansan. I love being here in Missouri, and in fact, part of my medical training was in Missouri. But I am very proud of Kansas. We have a unique role in the Union. We have been protecting America from Missouri since 1856.